Hello everyone. Today I'm here to speak on glaucoma, the silent thief of sight, on the occasion of World Glaucoma Week, which is being observed between 7th to 13th March. And thanks to Santon for giving me this opportunity. So to understand what is glaucoma, so it's a group of eye diseases where the optic nerve is being damaged. So what is this optic nerve? This is the nerve of the eye, which connects the eye to the brain. So this conducts the signals from the eye to the brain. So this nerve, that is the optic nerve, is getting damaged in glaucoma. So to understand this easily, so in previous days, we know that when you take a photograph from the camera, so we need to have a computer so that we can see the photograph in the computer. But how do we connect this camera to the computer? We need a cable. Of course, now we do have the Bluetooth and Wi-Fi systems to transfer the photographs from the camera to the laptop, but we do not have a Wi-Fi or Bluetooth for the eye. So you always need a cable from the eye to the brain. So this cable is nothing but the optic nerve. So it sends the signals from the eye to the brain. So when there is an increase in the pressure, this optic nerve, that is the cable, is being damaged and the image gets blacked out. What is this eye pressure? So this is similar to a cycle tire. So you need to have an optimal air inside the cycle tire so that we can have a smooth ride. In the same way, in the eye, we need to have an average pressure of 12 to 22 millimeters of mercury. It can vary anytime, anything between this amount of pressure. If you have low pressure, it is a problem. And if you have a pressure more than 22 millimeters of mercury, you have greater risk of developing the damage to the optic nerve. What is this eye pressure? So this, as we have already discussed, so this is the pressure inside the eye. So why is this pressure inside the eye? Normal pressure is there is because of the fluid inside the eye, which is being produced by the part of the eye called ciliary body. So this fluid inside the eye is being produced, and this fluid is being pumped out, or it gets exited out of the eye through this is called the angle of the eye, from which the fluid from the eye goes outside and to be absorbed into the blood. So when there is a problem, when there is a more accumulation of fluid inside the eye, you develop more intraocular pressure. But this normal system of fluid being generated and getting exited from the eye is there in every person, which is giving you the normal intraocular pressure. So why does this IOP build up? This is similar to a sink model. So if you have a sink with a faucet and a drainage, so from the faucet you have the fluid being coming out, and from the drainage it gets drained outside. So when you have more fluid from the faucet, the sink gets filled up. If the drainage is being blocked or it is being clogged by any particles also, the fluid remains within the sink, and this is similar to the eye. So the fluid inside the eye gets accumulated within the eye when there is a blockage in the drain, like the drain of the sink. So this is when it is blocked, you have more fluid inside the eye. So what does this more fluid inside the eye do? It will build up the pressure inside the eye, and this pressure is being transmitted to the optic nerve, which is at the back of the eye, and it is more sensitive to this increased pressure inside the eye. So whatever increased pressure or increased fluid in the eye, it is being transmitted to the optic nerve and thereby damaging the optic nerve. So what are the causes of glaucoma? So we have seen already that the drainage angle is being blocked, or there can be increased fluid secretion also. And what are the symptoms of glaucoma? So the worst part of this disease is you do not have any symptoms related to glaucoma. If the pressure is inside the eye is more, you do not have any symptom. Or when the optic nerve is damaged, there is a decrease in the field of vision. That is, the side vision is lost. Because the central vision is not lost, we are not able to understand that this field of vision is being gone. So very unfortunate that we do not have any symptoms. But yes, in some types of glaucoma, like angle closure glaucoma, when there's a sudden rise in pressure inside the eye, there can be symptoms like blurred vision, severe eye pain, headache, and colored halos. That is, you can see light around the lights, around tube lights, and you can have nausea, vomiting, or eye redness. So how does this glaucoma progress? In early stages, you don't have any symptoms, as we have already discussed, but later you can have some black spots developing within the visual field. That is the side vision, you can develop some black spots, and slowly these black spots increase and the field of vision is lost, and your vision becomes that you see through a tunnel. And slowly, as the damage progresses, it leads to blindness. What are the different types of glaucoma that we have? We have open angle glaucoma, we have different secondary glaucomas also, but the basic ones are the primary open angle glaucoma. So in primary open angle glaucoma, there is no physical obstruction. The drainage angle that we have already discussed, that exit pathway is functionally not working, that the fluid gets accumulated within the eye. So therefore causing a raise in the pressure inside the eye and damaging the optic nerve. There is also another type of glaucoma where the pressure inside the eye being normal, the optic nerve is more sensitive to this normal pressure and thereby cause damage to the optic nerve. So there is another type of glaucoma where this is called closed angle glaucoma. So in this kind of glaucoma, so you have this is generally seen in plus power glasses people, where the anatomy, or that is the eyeball shape, is such that the exit pathway itself is very narrow. So that's why you have more fluid getting accumulated, because the pathway is itself narrow. Sometimes you can also have some adhesions there within the drainage angle, thereby physically obstructing the fluid from going out of the eye. So how this glaucoma is being diagnosed? So you need to know the pressure inside the eye. As we have already discussed, that this pressure inside the eye is the cause of the damage to the optic nerve, that is the nerve of the eye. So you need to have a tonometry, that is the pressure checkup of the eye, which is being done by applanation tonometer. So this is more reliable. That is the blue light filter that you have, and the applanation tonometer that is there is more sensitive and more reliable in detecting the intraocular pressure rather than the non-contact or the air puff kind of tonometry that we have. The next thing is the dilated examination. That is, you see the optic nerve. So you need to have a dilated examination in the eye specialist clinic so that you can see the health of the optic nerve. And then we can see the perimetry, that is the field of vision. That is because this is being affected when the optic nerve is being damaged. So you need to check the field of vision. Then gonioscopy is a test where you see the angle of the eye. So you see the angle of the eye, whether it is narrow, as we have already discussed, there are different types of glaucoma. So you need to see whether it is narrow or it is open, or is there any other cause thereby causing raise in intraocular pressure. Then pachymetry is something called, it is used to measure the thickness of the cornea, which also helps us in deciding the amount of treatment to be given to a patient. So why are we having so many diagnostic exams? Because glaucoma is a disease where the treatment varies from individual to individual, and all these factors and all these tests and various individual factors that we consider in deciding the treatment about the patient. So how is it treated? So when you have high intraocular pressure, you give medications so that the eye pressure is being controlled. Or there is also laser surgery, where in case the angle is narrow, so this laser would help in preventing the progression of progression, so that there will progression to a stage where they have permanent adhesions there. And you can go for surgery when the pressure is not being controlled only by the medication. So who are at risk of glaucoma? So people who are more than 40 years of age, or they have been using steroids for a long term because of any other medical condition, or who have high myopia, that is, who have high minus power glasses, or they have high blood pressure or diabetes, thereby requiring frequent medical examinations. And if you have family history of glaucoma, definitely you need to get yourself screened. And if you have thinning of the optic nerve, which is being tested when you are getting tested at an eye specialist, or if you have high intraocular pressure, that is the pressure inside the eye, or if you have had the eye injury previously, or if you have thin corneas, all these are risk factors of glaucoma. So in nutshell, it is a disease where there is an increase in intraocular pressure that is damaging the optic nerve and thereby causing the loss of field of vision, that is the side vision is being lost. So what you need to do is, if you are more than 40 years of age, or if you have high minus power glasses, or you have been using steroids for a long term because of any other medical condition, or any of your family have glaucoma, please get yourselves tested without fail every 6 months to 1 year. And if you're already a glaucoma patient, you need to use the medications as prescribed regularly without fail. And you should periodically get checked up with your doctor so that to see that the pressure is under control. And also you need to take your family members to the doctor to see that they have glaucoma, because you know that whatever black spots or the field of vision that is lost, you do not regain that back. Once it is lost, it is lost. So you need to detect it as early as possible so that the field of vision is maintained. So vision loss cannot be regained, but further loss can be stopped by medication or appropriate treatment. Thank you. So this is a glaucoma simulator, which will help us understand the effect on vision that the glaucoma can have. You can have some black spots in your vision. You can see that the peripheral field of vision is being constricted slowly. So slowly it gets constricted so that it becomes like you're seeing through a tube. So you're carrying tubes inside the eye through which you're seeing. Thank you.